Welcome,
Wow.
everyone. Welcome. Now, everyone is popping in here. Welcome to the Consciousness and Healing Initiative's Ask Me Anything series. I'm your host, Dr. Shamini Jan, and I cannot even begin to share how incredibly deeply honored I am to have as our guest today Dr. Daniel Vicario. So I'm going to tell you a few things about Dan because I've known him for a long time. At least I think, Dan, what, 15 years or so? And I still remember when I first met you and I came to you and said, I want to do a research study with energy healing and cancer. And you said, well, why don't you come and shadow me for a day? And I did. And I have to say, from that point forward, just watching how you interacted with your patients was incredible for me as a budding clinician, to see the compassion that you shared, the knowledge that you shared. And I'm just absolutely thrilled that you're sharing that with everyone here today. For those of you who've not met Dr. Dan Vicario, let me tell you a little bit more about him. He is obviously a board certified medical oncologist. He is well known in the UC San Diego community, where he was medical director of the San Diego Cancer Center for a very long time. His nonprofit, the San Diego Cancer Research Institute, or SDCRI, from 1995 to 2015, was providing free integrative care for all cancer patients in San Diego. So not only is he a fountain of wisdom on integrative care for cancer patients, but he has been a provider of those for many, many years. So, Dan, thank you so much for being here with us. Really appreciate it.
Thank you. Thank you. Yeah, this is great. It's a great opportunity.
Yeah, really is. And I understand, now a couple of things just to share with y'all. Logistics, Dan, if you don't mind, I'll just share with folks so everyone's kind of clued into how the flow of it's going to go for the hour. This is an Ask Me Anything series, so most of the time is going to be devoted to getting your questions answered around integrative oncology. So a couple of things to note. All of the presentations that are provided by our esteemed guests are their views and not necessarily representative of the organization of the Consciousness and Healing Initiative. I have to say that. Obviously, Dan is the medical expert. At the same time, we want to be clear that anything that is shared at these Ask Me Anything sessions is not intended to be substituted for medical advice from your doctor. And so we highly recommend that everything that you hear here, you consult with your physician and talk with them about it. And, of course, as you know, the Consciousness and Healing Initiative, as well as other organizations, have many, many resources for you to share with your doctor in terms of the evidence base behind some of what's being shared. So I wanted to share that. I also want to share with you how you can ask your questions today. There are really two ways. Some of you, Chi contributors, thank you to all the Chi contributors for contributing to the Consciousness and Healing Initiative. We have received your questions as part of your benefit, and we will get to those for sure. For those of you who are just joining us, have not submitted questions through the Chi contributor model, you can ask your questions today by either using the chat window, or I invite you to simply raise your hand. And the way you do that is you click on the bottom of your screen that says participants. When you click on participants, you'll see on the right, on the bottom part, there's a way to click raise hand. So once Dan is done with his overview, we get into questions. You'll have an opportunity to raise your hand in this way, and we'll call on you, and you can ask Dan your question live. So with all of those logistics, kind of out of the way, Dan, thank you so much. We're absolutely thrilled for your overview. You've got so much wisdom for many decades in integrative oncology.
Well, thank you. I mean, so much that I've learned from the patients over the many years. So a lot of that, what I'll share is the wisdom from the patients, of course. So I'm really grateful to each one of you for taking the time to be here. It really is an honor to be with all of you. For those who are unable to join us today, you'll have this video available on the Chi website. Thank you so much, Shamini, and all those devoted, that devote countless hours to the Chi initiative, really. Integrative oncology is really a very extensive topic. And we were talking with Shamini, it would take actually 2 to 3 hours to just cover and scratch the surface of integrative oncology. It really has been a passion of mine for many years, even when I was a busy medical oncologist. So we are considering a webinar with Shamini and the Chi team in the future. where we can really deep dive into integrative oncology. For me, it's been an honor and a privilege to work with cancer patients for over 30 years. I've learned, as I said, so much from them. So for the first several minutes, I would like to share some key concepts in integrative oncology, and the PowerPoint slides will be available on the CHI website. I'm just going to go through them very quickly, so please have some patience and know that you don't have to take notes, because you're going to have these slides, you're going to have the videos, the video available and the slides available. So there are several slides, and I'm going to just point to some of the key concepts. So I'm going to share. So we're ready to start, right?
Absolutely.
Yeah.
Yeah.
Okay. So I'm going to share. So basically, what I would like to talk about today is very briefly what causes cancer, going over some evolving cancer treatments, the importance and benefits of integrative oncology, complementary modalities that improve the quality of life of cancer patients. There are countless scientific articles in very, very well-respected journals that have been published. We want to talk about empowering ways to look at cancer and its treatment. And for those integrative practitioners, healthcare professionals, and all caregivers, the importance of taking care of ourselves. And then most importantly, supporting cancer patients in their healing journey. So when we have this conversation, we're going to be thinking about loved ones that are dealing with cancer. So that's one of the intentions I always have, and we can have together, is to bring into this gathering our family members, loved ones, friends, co-workers who have or had cancer, and we can honor them and hold them in our hearts. So what causes cancer? It really is multifactorial. There are, we all know, hereditary factors, genetic predisposition. There are cancer genes that are overexpressed, tumor suppressor genes that are downregulated, environmental factors, lifestyle risk factors, epigenetic influences, and then DNA replication errors and random mutations. And I want to bring up this report that was published in the journal Science a couple of years ago, which is incredibly, I would highly recommend anyone who's interested to look at this. They talk about DNA replication errors, and these random mutations are responsible. In their study, they looked at thousands of patients, that these mutations are responsible. They found 2/3 of mutations in human cancers, and many arising from just unavoidable random mutations. So we know there are environmental factors, hereditary, but these random mistakes made during normal DNA replication can explain why cancers occur. And I want to be a little more conservative and just say, at least if we think about 1/3 of cancers that happen from random mutation, I mean, we can do everything right. And that's why, and we'll talk about this, teachers and healers who do everything right still can get cancer. So when cancer spreads, we call it metastasis. Cancer cells can remain dormant for many years, even decades. So that's why it's so important for us, if we've had cancer or are at risk of cancer, to really make sure that our body is strong and our immune system is strong to decrease the risk of cancer. When we work, I'm a medical oncologist, and we work as a team with the surgeons and the radiation oncologists. Then we want to bring in genomic oncologists, and we want to bring in integrative oncologists. So very briefly, advances in medicine and science, this would take a long conversation, but fortunately there are so many improved medicines that are more effective, more targeted, and with less side effects. There are monoclonal antibodies like Rituxan, Herceptin that you've heard of. I've seen so many patients over the decades. It's been 25 years now that Rituxan was available. Herceptin has been 20+ years. With advanced, considered incurable lymphomas cured with Rituxan, incurable metastatic breast cancer that were cured, placed in a remission with Herceptin. There are targeted molecular therapies like Gleevec that can cure CML, chronic myelogenous leukemia, anti-angiogenic factors, Avastin, then there's thalidomide, Revlimid. I know some young people with multiple myeloma that in the past they would have required a bone marrow transplant to be cured, and now they can be in remission with just Revlimid or thalidomide. There's immunotherapy, vaccines. We know that chemotherapy can cause a lot of side effects, mostly GI, low energy, neuropathy, potential organ damage, et cetera, et cetera. So this is where we want better agents to have less of these side effects, but also more importantly here for integrative medicine is all these different modalities we'll be talking about how they decrease these side effects and in different ways. So these are very powerful complementary healing modalities that we'll be discussing. Also new advances, there's symptom management, apoptotic agents, which are for natural cell death, stem cells, chemosensitivity, chemoresistant assays, the importance of microbiome, molecular profiling, genomic oncology, precision therapies, metronomic chemotherapy, which is lower doses of chemo. There are a lot of studies that show how efficacious that can be. And then epigenetics, of course. So epigenetics is the gene expression is influenced by many factors. There are hormones, metabolites, food, microbiomes, chemicals, environment, lifestyle, social interaction, thoughts, emotions, relationship, and many factors. But I want to bring this up because there are studies that show that, for example, meditation can cause an epigenetic change that will upregulate and stimulate those protective genes. So there are those studies that have been done by several centers and universities. And there are these studies, and hopefully in the next webinar, we can go over those studies and many others. I want to bring up these definitions quickly. CAM, you've heard of complementary alternative medicine. We heard of holistic medicine. Now, when we are talking with colleagues in medicine and the medical establishment, it's great to use the terminology integrative medicine and integrative oncology. And another thing about cure and healing, a lot of people are cured but never feel healed. And many are quote unquote not curable from their cancer, but they do feel that they're healed. Now I say this quote unquote incurable because I believe, and we all know, that a lot of people can be cured from even the worst challenging cancers. So we'll get to that. So I like this phrase, healing doesn't mean the damage never existed. It means the damage no longer controls our lives. Again, don't take notes because you're going to have these slides and I'm going to be reading just key concepts. So integrative medicine is really an emerging specialty that incorporates the art and science of caring for the whole person, body, mind, spirit to prevent and treat disease, empowering patients to create a condition of optimal health, wellness, and healing, incorporating evidence-based natural therapies, complementary healing disciplines and modalities in the care of patients and their caregivers, and the safety and efficacy of these therapies. And there's an Academy of Integrative Health and Medicine, AIHM, that I strongly recommend if you want to look at their website. They have so many resources. Integrative oncology is an evolving specialty in oncology. It's patient-centered, focusing on health, wellness, and supporting the healing journey of cancer patients. It's very much desired and requested by patients, family members, cancer center staff, and society at large. It's caring for the caregivers as well, the nurses, doctors, and all staff, and maintains an optimal healing environment for the patients first, their loved ones, caretakers, nurses, doctors, and staff. And there's an established Society of Integrative Oncology, another website that I recommend if you want to look at. There are so much there, and they have annual meetings. And then there is, I'll go over a book too that has so many scientific papers. And in this website, you're going to find them too. So benefits of integrative oncology is less symptoms from cancer and its treatment, fewer visits to the doctors, improving the quality of life of patients and their caregivers, decreased hospitalization, supports the medical environment for those who are in the healthcare establishment, the importance for them to realize that it will reduce healthcare costs, education, research, and collaboration. So in the last several years, there have been collaborations in California between GE, SDCRI, UCSD, AIHM, Scripps, UCSF, UCLA, PCOM, Bastyr, Chopra Foundation, IONS, et cetera, the list goes on and on. So this is the book, Integrative Oncology by Don Abrams and Andrew Weil, that I recommend if anyone who really wants to deep dive into this topic. It's a long book. It has quoted hundreds and hundreds of scientific, well-proven articles with the power and efficacy of the different disciplines. So when we look at integrative healing traditions, Hippocrates is the father of medicine, and there's osteopathic medicine, naturopathic medicine, Ayurvedic medicine, TCM, Native American medicine, and so many other ancient healing traditions. So very quickly, when we talk about cancer prevention, what can we do? These are the things that we do also for to help people that have cancer. But just if anyone says, how can I decrease my risk of cancer? Well, the first thing, and we're going to talk about these things, the importance of nutrition, some type of exercise, movement, good breathing. Stress management is going to be so important with all the techniques available. Good rest and sleep, detoxification in all aspects. It's not only what we eat, but detoxifying socially, emotionally, the news, et cetera, et cetera. The importance of feeling in control, empowered, inner peace, homeostasis, self-regulation, and then early detection for those who have risk for cancer. So let's go over some of the complementary modalities. Number one is going to be always lifestyle changes. Then we'll talk about briefly nutrition, gentle aerobic exercise, yoga, which is not only the exercise, but yoga teachers call it, it's a lifestyle. It's a whole discipline. Acupuncture, TCM, massage, aromatherapy, and it's a long list to continue. So Hippocrates said some time ago, let food be thy medicine shall be thy food. So when we look at nutrition and cancer, there's extensive scientific data on the importance of this. And it's whole food, plant-based can be very important. Mary Hollander, the coordinator of our San Diego Cancer Research Institute, she's really an incredible nurse, Reiki master, and has so many expertise, but she's also got into nutrition on our website at STCRI. Mary talks a lot about the importance of whole food, plant-based, organic, freshly prepared. Nutrition program needs to be individualized and customized. Special situations, we can go into this later if there are questions, ketogenic diet, intermittent fasting, creating a peaceful and relaxed environment, no extremes. It's really all about balance and blessing of the food, the source, those who prepared it, and the company we are in. So Colin Campbell has a Center for Nutrition Studies. He says nutrition is the master key to human health. I got to meet him many years ago. We both gave a talk in an integrative medicine conference at UCSD. He really has a whole program on living a whole food, plant-based, but life. New England Journal, December of last year, had an incredible article about effects of intermittent fasting on health, aging, and disease. They went over all these different types. And then, interesting enough, this past January at the American Academy of Integrative Medicine conference, most of the speakers for all the different disciplines were talking about the power of intermittent fasting. So it was great to see. And here's this article from the New England Journal. So botanicals, very quickly, there are too many to count. There are potential risks and side effects. Several herbs have powerful antioxidant, anti-inflammatory, anti-neoplastic properties. Some may counteract with medicine. So that's why important as herbal medicine is a specialty to work with practitioners that have experience in dealing with these herbs and helping those who are on cancer treatment, on chemotherapy, on radiation, and what herbs to use and which ones to avoid. Curcumin, you've all heard about. It's so powerful in cancer. It can enhance chemotherapy activity. It may protect against some chemo effects. It can overcome chemo resistance, induce chemosensitivity, anti-inflammatory, et cetera, et cetera. So this is, again, we'll have to deep dive sometime in the future. Botanical, probiotic, Ayurvedic herbs are incredibly powerful. Traditional Chinese medicine, to treat mucositis, there is lysine, glutamine. For neuropathy, there's alpha lipoic acid. Aloe vera can be very helpful. Ginger, incredible for nausea, vomiting, gastroparesis. Botanicals for altered taste, there's a combination that can be used of ginger, honey, lemon, black salt. Importance then of vitamin D, C, melatonin, homeopathy, medicinal mushrooms, medical CBD, and this is, the list goes on and on. So very briefly, for yoga, for example, this is the Journal of Clinical Oncology, which is the Bible of all oncologists. So there are hundreds of articles that show in the Journal of Clinical Oncology show that all these different modalities, how effective they are. So for example, a randomized trial looking at yoga and the impact of inflammation, mood, and fatigue, it showed that it really helped in 200 breast cancer survivors. They even measured pro-inflammatory cytokines. So we know it works, but this is for my colleagues. When I give talks to my colleague oncologists, I show them all these articles. So acupuncture, it's a whole system approach. There's extensive scientific literature, improves symptoms from cancer, the side effects from treatment, enhanced therapeutic effect. We use it for pain management, dry mouth from radiation, nausea, vomiting, anorexia, weight loss, hot flashes, neuropathy, fatigue, et cetera, et cetera. So in Journal of Clinical Oncology, there's a randomized study using acupuncture, how it helps hot flashes in women with breast cancer, cancer-related fatigue, and then nausea, vomiting, and a list goes on and on. The importance of massage, how important it is it's very safe. I tell my oncology colleagues, in the right hands is extremely safe, and there are many reasons to use it. And massage therapists have special awareness of risk of infections, DVTs, fractures, skin sensitivity. It requires a special training. Terry Polly, who's an incredible nurse and massage therapist and has many other incredible quality volunteers at our center. She had a special massage therapy for cancer course, and all the massage therapists went to that course before they treated the patients. Support groups are very critical for patients, caregivers, for children. It really is a team approach. There's survivorship, thrivers, and then meta-thrivers. There are groups that of people with metastatic cancer, and they call them meta-thrivers. There is an American Society of Psychosocial Oncology Society. You can look at their website too. So let's get into, I call them empowerment techniques, which is visualization, contemplation, guided imagery, biofeedback, MBSR, all types of meditation. This is key. I would put this as a top list for anyone that has cancer or any other illness. The power of meditation, we can't underestimate it. In JCO, they have this randomized trial of mindfulness-based stress reduction. It significantly improved the broad range of symptoms in women with breast cancer. So here, this I know Shamini loves this, and there's so much research in biofield therapies that we're working with the Qi, STCRI, and many other institutions. Healing touch, therapeutic touch, Reiki, Qigong, Tai Chi, energy. They have different names, techniques, and practices, but it really is, we are energetic beings. And Faye Magru, who offered Qigong every week at our cancer center for years, patients would come, even while they were getting chemotherapy, as you can see in this picture, they would be having a 1-hour session of Qigong. The nurses would come in and out, be changing the medication bags, and it was incredible how powerful Qigong can be. So our friend Nikola Tesla over a century ago said, if we want to find the secrets of the universe, think in terms of energy, frequency, and vibration. Continue on the list: physical therapy, art therapy, pet therapy, music therapy, humor, laughter, yoga, journaling, grounding, quality of life, spirituality, power of prayer. We have this Hope Made Visible program, SDCRI, international program. These flags, over 2,500 are made by cancer patients all over the world. And here's, for example, they were shown at a university here in San Diego. They send these flags, some of them, to hospitals and medical centers, not only in the US, but in other countries. And Alessandra and Mary Hollander and others at SDCRI have been making this happen. Our dear friend Larry Dossi has written this book, highly recommended, Healing Words, The Power of Prayer and the Practice of Medicine. Then our dear Mother Teresa had this prayer for meditations on the spiritual life for people of all faith. So one of the things I've heard over the decades from patients is, and I love this concept, blessing, asking the highest power that we know of to bless our water, food, medicine, supplements, chemotherapy, radiation, everything and everyone. So when we look at these integrative modalities, how do they work? It's usually one or a combination of these. They're immune modulating, anti-inflammatory, endorphin producing, hormone regulating, antioxidant, they induce apoptosis, anti-angiogenesis, epigenetic effect, restored balance. The goal is synergy, and it really is practitioner dependent. That's why it's so important to work with practitioners that have integrity and they're true healers. So what I recommend, and I think we all recommend patients, that to meditate and through their intuition, find those powerful healers and teams with true integrity that will help them and feel empowered and support them in their healing journey. So here's a powerful healer. Gracie came to our chemo room once or twice a week for years, and here giving her loving therapeutic modality to the patients. Pet therapy is incredible. Some of you may be pet therapists. So the importance of taking care of ourselves, applying the wisdom of all healing tradition, practice what we preach, seeing patients as our teachers, which is so critical, grieving with our patients and staff, dealing with the stress, helplessness, overwhelm, and burnout, what we call compassion fatigue. Because we have challenges in the medical environment, there's no question about it. Unfortunately, the nurses have been the angels in the medical center who really have helped hospitals and clinics survive, all about the angel nurses. And then embracing uncertainty and unpredictability. The problem with cancer is we can do everything right, still develop cancer, as I mentioned before. Children with cancer, healers with cancer, there are sometimes tumors that are resistant, there are recurrent cancers. Then we look at the importance of quality of life and the blessing of palliative medicine and hospice teams in certain situations. But there's always hope. Like Albert Einstein said, there are only two ways to live our life. One is nothing is a miracle. The other is everything is a miracle. So we're getting to our last couple of slides. What can we tell patients? You all know this: honor your feelings, trust your powerful intuition, your inner wisdom. Be with those that make you feel good and at peace. Stay away from situations that are stressful. You're unique. Do not compare yourself with others. Accept health. You're always given. Cancer patients are so givers. So this is a time for them to embrace, ask for help. See medicines and chemo as healing treatments, tools to help them in their healing journey. Visualize the potential for infinite possibilities. There's always hope for any condition considered incurable at this time. An answer is around the corner. And we've all seen miracles, spontaneous remissions. I mean, I've seen several of them in my career. Then you know how to help someone is being present with intention, empathy, compassion, just knowing the importance of healing that can help people even cure. Respecting their belief, cultural disciplines, help them create their own healing environment. And it really is nonverbal, embracing uncertainty, hope, and belief. Being an alchemist. And I love St. Francis' prayer, Lord, make me an instrument of your peace, et cetera, et cetera. And compassion without words is so much better than words without compassion. So for us to just listen is critical. Doctors need to learn this. I keep telling my colleagues, just listen. And then entrainment, limbic, resonant, and mirror neurons is basically when we are in a good place as practitioners, that will be transmitted to our clients, our patients. So this is the last slide. Daily ritual summary is good sleep, plenty of rest, meditation, reflection, prayer, optimizing nutrition, exercise, breathing techniques, yoga, stress management, honoring our emotions, embracing uncertainty, feeling in control, feeling empowered, balance, inner peace, grounding, being in nature, and having a sense of purpose and gratitude. So that's it for now. And Shamini, I will pass it on to you.
Wow, Dan, thank you. Thank you for that beautiful overview. And I know, you have addressed several of the questions that came in the beginning from patients and from our community. And again, I just want to thank you for all of your tireless, compassionate work as an integrative oncologist for so many decades and being a leader in the space of integrative oncology. I know I speak for everybody really on the call, many who are sending you love through the chat already, that we're deeply, deeply grateful and appreciative to you. So thank you very much. One of the things of many things that I appreciate about you, Dan, especially in these times where it feels like sometimes we have these polarizing forces that are trying to, make us almost feel like we have to choose. It's an either or kind of situation and everything in life, it seems these days. And I believe what you're sharing with us is, again, this is not an either or, it's a both and. When we have cancer, we have a variety of approaches that we can choose that include what are considered medically conventional choices. And you've spoken about some of them that have been life-saving for your patients, right? And at the same time, using the best integrative, what are called complementary, indigenous, whatever term we want to use on it for our self-healing capacity, for working with those forces in the body, as you mentioned in that Hippocrates slide, right? That
Yes.
we don't have to choose. And yet, as you know, sometimes the way medicine is taught in practice, some of our doctors may not be clued into all of these different approaches, right? These time-honored approaches that are supportive in our cancer journey. And I'm just wondering, what advice might you have for people that are here, whether it's with a loved one or for themselves? And how do we talk with a conventionally trained oncologist about our interests in engaging in these therapies?
Yes, great question. So this is what I always mention. I mean, my colleagues, I've been a medical oncologist for 25 years or more. And I always had the interest of integrated, but I was so busy as a medical oncologist that I could barely catch up with the knowledge and advances in science and in oncology. So what I tell the patients is something like this. First of all, see that their oncologists are really, really caring about their situation, even though it doesn't seem like it sometimes, but they deeply care. I mean, I've seen my colleagues crying in the doctor's office and and in the hospital, in the doctor's lounge, they're crying because they see that they don't know how to deal with the loss when patients are doing poorly, when they're doing everything they can, and there are complications. And so they're doing their best with the resources they have. They're spending all their time in this box of science and medicine, which is great. It's powerful. And they don't have time to read about integrated modalities. So I tell them, work with integrated practitioners that you trust and refer the patients to them. But specifically to first to see the oncologists as they really care. They're doing the best they can with the resources they have. Number three is if they really, this is one of the problems. Oncologists have a medical legal responsibility to tell people how bad things could be. They are liable if they don't tell a patient what the statistics are and how bad this could be. Now, there are ways to phrase that. And I figured out a way myself to always give hope, even though the statistics look challenged. So we can, but it takes time. And a lot of oncologists, unfortunately, in the system we have, they don't have that time. So it's ridiculous. They should make the time to communicate with their patient. But now with electronic medical records and this and that, that is taking away their time with the patients. And with all the new techniques and technologies and the new treatments, it's so complex. So I would tell patients that if someone tells me, my oncologist was very pessimistic with me, I would tell them, medical legally, that's what they need to do. Now, you can tell them, I would say, please, doctor, I know you care about me deeply. I know the statistics, I understand them. I really want us to focus our time on the best that could happen. That's going to help me. And even if I make decisions that are a little different, I take full responsibility. Doctors are worried that they'll be sued if someone doesn't do exactly what they're told, or they're using integrated modalities that potentially could counteract with. None of them do counteract when we work with practitioners who understand how to help someone with cancer who is on chemotherapy and radiation and all these different medical modalities. So there are never interactions when we're working with practitioners with integrity, naturopathic doctors and practitioners who really have knowledge of medicine, science, and their healing art. So I think it really is critical, and having this conversation is important. And the other thing I mentioned is, before going to see the oncologist, do a little meditation, a prayer, visualization, like a ritual where you're connecting on a heart and soul level with that oncologist. And you appreciate the oncologist as they appreciate you. And you're in that frame of mind of just connecting with them. And you'll see the visit will be incredible. The oncologist will feel it. We talked about entrainment and mirror neurons. So that entrainment occurs. If we're, and it's ridiculous to us to say that, for a cancer patient to have to do that, but it's a system that is broken. And fortunately, a lot of thousands of people are helping the system evolve. First, the nurses, but then so many others in the system are helping it evolve to a point where the oncologist will have the time to spend with a patient, and will have some education on integrative oncology, so they can tell the patient, this is what I recommend. These are the medical treatments. I honor your wisdom to what will help you. And I'll refer you to integrated practitioners that have experience and integrity that can work with you with all these different healing modalities that will definitely help in your situation. I hope that answered it, Shamini.
It's great, Dan.
We could go on and on. There's so many other things.
There's so much to this, and one of the things that we've noticed is, particularly in the biofield space, right, with biofield therapies, is there's a lack of translation, if you will, in terms of what the evidence base actually is behind some of these approaches. And like you said, until medical education, is able to sort of take in all of the evidence base for these integrative therapies. Sometimes doctors don't know about the evidence base behind particular integrative therapies because it's not something that they have been taught to focus on. So you mentioned, for example, our partners, the Academy for Integrative Health and Medicine. If folks don't know about AIHM, they're a super organization. They have tons of resources, online courses for medical practitioners and the public in many different areas in integrative care. So they're a resource, and San Diego Cancer Research Institute's website is also likely a resource, right, for cancer patients, as well as potentially sharing some of the evidence base for providers who might want to actually look and see what there is behind these integrative therapies that you've so wonderfully described, right? So one thing that I often recommend to cancer patients as well, or any patient, is when you're talking to a doc who's not very familiar with integrative care, to see if you can send them to some of these professional websites so they can see for themselves what the evidence base is. And of course, at CHI, at the Consciousness and Healing Initiative, we have had our focus on the Biofield therapy evidence base for some time.
Yes,
Jason.
and many of us, integrative oncology, we're giving talks to our colleagues. I mean, that's really my goal is to communicate with my colleagues, to give them these slides and many more with all the evidence-based data on how these modalities help. And I tell them, it's actually, unfortunately, they really don't realize that it's not ethical to not bring up these modalities, and it's unethical. I tell them, you really have, these things work. So you have to look at the Society of Integrated Oncology, look at AIHM, look at our nonprofit website, SDCRI, look at the resources, and really encourage your patients to support them, first of all, when they tell them, doc, I'm doing this and that, support them. Not say, oh, it doesn't make any difference. That's ridiculous. I mean, it's a nocebo effect.
Yeah,
On to
which
say
is
those
very
things.
powerful.
Yes.
It's very powerful. Well, I want to honor folks' questions. So Dan, if you don't mind, we'll just jump in.
Let's do it.
Questions from contributors, and then I see some in the chat window. Also encourage folks to raise their hand if you'd like to interact with Dan live. One of the wonderful things about being able to use these virtual platforms is to connect all over the world, live and in person. But we'll start with Zilu, and I think that Dan, you'll appreciate this question. The nut of this question is, one, do you feel that it is true that people are easier to become religious when they get cancer? In general, the question surrounds, do we feel that if cancer patients can change their view of the world through spiritual cultivation, that it has a strong effect on the progress of healing?
That's a great question. And I think we all live our lives not realizing, again, how important so many things are in our life until an illness happens, or an accident, or when our body is not functioning. Then we realize, and we open up to other things. And many people do have a spiritual background, and they get back to that spirituality, which we all should be practicing it daily. Whatever religion it is, we're talking about general spiritual principle. But when we have an illness, it does bring us back to our spiritual beliefs. And I've seen patients with cancer over the decades that when they really got connected to their spirituality and spend time in that reflection and prayer, not only they live with a better quality of life and they did better with the treatment, but they did better with their cancer. Our nurses at the cancer center would pray silently when they were giving the chemo. Most patients didn't know that. They would pray. And what we've observed, I mean, you can't do a clinical trial with this, but it works. These people did better. They did better with the treatment. They had less side effects from the chemo. So when patients do connect to their spirituality, absolutely they'll do better. And statistically, they'll do better with a better quality of life and less side effects from the cancer and the treatment. So yes, I mean, there's science behind meditation. There are studies about spirituality and prayer and illness and cancer, and there's no question. I've observed it. We've all observed that. Everyone who's watching this understands this. So our patients, those who are dealing with cancer, I would say, in a very high percent will get back to the spirituality of their custom and their background, or into a new one that they feel better, where they feel more connection to the divine.
Thank you, Dan. That's wonderful. And it's wonderful for you to share, from firsthand experience what you've seen take place in the cancer journey with respect to returning to one's own spiritual core, and how helpful it can be. The next set of questions comes from Miriam, and I'm sure this question resonates with many people because this is a question that many cancer patients, I think, ask, which is, do you have any specific recommendations around nutrition? There's so many different schools of thought, and there's research, as Miriam notes, from, vegan diets to Mediterranean to keto. We've had a question from one of our attendees here right now, Alpana, who also asks about sugar. Can you give us some advice on nutrition during
Yes.
through the cancer journey?
Yeah, absolutely. I mean, yes, I'm going to do this as brief as I can. Nutrition is critical, and the sugar issue is a big one. So avoiding carbohydrates, processed carbohydrates, is key in anyone with cancer. And there are the fasting. I mentioned the New England Journal of Medicine, AIHM. I mentioned when they gave their conference, they talked about the different nutritional programs for different conditions. So for cancer, there are ketogenic diets that can help some specific situation. There are fasting that can help other situations. So that's why the nutrition program for any of those who are nutritionists and experts in nutrition, you already customize the treatment for each patient, because it really needs to be individualized for different patients, their own situation, their own cancer, their own condition, their own beliefs, what they can do. So I would say it really is it's a great question. And it requires, I mean, it's a half-hour answer to go over the specific nutritional programs that can be used in different situations. But that's why I would use resources like the Society of Integrative Oncology, AIHM, and then Colin Campbell's. The plant-based and organic, of course, is so critical without these different chemicals that are unfortunately in so many of the foods now, and freshly prepared and all that. It really is important. Now, cancer patients sometimes don't have that time. They're busy, and they can't focus a lot. So that's where we encourage them to ask for help, ask family or friends to help them with their meals and prepare really healthy meals. But yeah, there are specific diets for specific situations, and that needs to be customized. Looking at that New England Journal article, and there are some other articles too that talk about this for cancer. In ketogenic, where I did have a slide and I had to remove it, but actually, hold on.
Clearly you're a wealth of information here, Dan.
This is important because I did. Let me get to this slide here, because I had it here.
Great.
Moderate carb restriction and hormone receptor positive postmenopausal breast cancer patients, and colorectal cancer, and patients that are overweight. Ketogenic diet in glioblastoma multiforme, and in some different situations, patients on radiation, they can help with can help to be on a ketogenic diet. Fasting 24 hours before and after chemotherapy. There are some studies that show it makes the cancer cells more sensitive and jittery, where they can be more sensitive to the chemotherapy. And then, of course, for cancer risk reduction, that's also. So these are just some of the information that I have other slides too, but we don't have the time to go over it. But I hope that
Not today.
that's a fantastic question. I appreciate those who asked that question. Yeah.
Thank you. Thank you so much, Dan, for that thorough response. And yeah, truly, to be able to answer a question like that in just a few minutes, I'm realizing we need a lot more time with you. I think there's a lot here to cover. There is a second question from Miriam that I think, while it seems a little specific, might apply to others, and it's certainly kind of a broader question too about what to do in these particular situations. So Miriam shares that, her husband had a morphoproteomic analysis that was ordered by his OMD. And the upshot of it was that based on that analysis, there was a suggestion that using metformin and simvastatin off-label could be beneficial for his cancer. But what they found was that their oncologist was reticent to use it for off-label use. So her first question is, have you heard of this type of analysis before? And two, do you have any advice for them on how they might proceed given the situation?
Yeah, so metformin, we know a lot of integrative doctors use metformin. They recommend it, and naturopathic doctors use that for their cancer patients. Many oncologists just they don't. I've shared articles with them about the importance of metformin in cancer. I mean, it can be very, very helpful as an adjuvant to whatever else they're doing from the medical perspective. Simvastatin too. The problem, simvastatin may have some side effects, and oncologists are concerned. And especially if they don't know, they're concerned about the potential interaction. So what I would say is a little bit what I mentioned before. Doctor, I know you deeply care about my situation. I'm working with an integrative practitioner who's recommending this, who understands that it's safe. We can give you some articles, but I would just really appreciate, I take responsibility of any potential complications or interaction, which we know there are none, but just saying that, I take responsibility. And the oncologists, many times they fear that if there is a complication, that they are responsible and they are medically legally responsible. That's unfortunately, fear drives human behavior. And I've seen it again and again and again, where oncologists really, because they don't know, they say, no, don't take those herbs and supplements because it could counteract. And most of the time, patients don't tell their oncologists, and I can honor that. But when you're working with practitioner, nutritioners, naturopathic doctors, and integrative medicine specialists who are recommending certain herbs and supplements and medicines, adjuvant medicines like these, they know that they're safe. So that's why it's important to find practitioners who understand cancer, understand the potential interactions. Yeah, that's a great question.
Thank you.
Metformin is used a lot. Yes.
Great answer too. Several questions coming in. So just and a couple of these, I think some of them, Dan, you've addressed a bit in your presentation, but just for completion's sake, here's one that I know you'll appreciate from Carolina, which is, what are the updates on energy medicine research in oncology?
Oh, so much. I mean, really, one of the things that I do have to say with these incredible scientists that are working all together from CHI and other organizations, when we have our meetings and get together and talk about the power of biofield therapies, there's a lot of data already, yet there is so much more that we need to work on. And many organizations are working together. But there's no question. I mean, there are new devices now, like the BioWell that Tiffany Barsotti uses, and many other devices that measure energy in our body, and the whole acupuncture meridians of our body, and how they will improve with just one session. So I've been so fortunate and honored to know incredible practitioners that are powerful healers. They don't like us to use that word, but Blanca Noel and Mary and so many others who have been working with us at the Cancer Center, who would give a session to a patient who was really sick with advanced metastatic cancer and was in terrible pain and physical pain, emotional pain, and just one session of energy work would change their life. Not only that day and the next week, but it would change their life. Mm-hmm. And so being in the presence of a healer like Paul Brenner, who's been running our support groups, and people that have, and we all know those true healers, they never market, they're never known of, only if we refer a patient to them, but just their presence will transmit energetically this understanding when someone has cancer, especially if they have an advanced cancer, to understand and know that they live with uncertainty, that they can heal from this cancer, that the cancer can potentially melt away, even though the system, the medical system, doesn't know how to. But the medical system limitations are not people's limitations. And that's what is important to remember. So energy healing works. There are enough articles, countless articles in respectable scientific medical journals that show that these different modalities, I mentioned some, hands-on healing, Reiki, Qigong, Tai Chi, one-on-one healing, and even distant healing. I mean, there are reports about distant healing, and we know it works. And I've seen it work. Now that we're in this pandemic, I mean, cancer patients will connect with someone that does great energy work at a distance, and they'll feel it. They'll physically feel the changes in their body. So there is data. Uh, Maybe at the next webinar, I can show some of the articles, but there's
Absolutely, yeah.
incredible data.
And
Yes.
just to punctuate that a little bit, we've got a couple of energy medicine researchers with us today, and many who have worked in cancer for many decades. Bill, I see you're on the line. Thank you for being here. Bill is, ramping up even more additional research that he has done over the years, with cancer specifically, and animal models, but also in other models. And those of you who have been with Chi for a while might remember that we had a recent webinar with Dr. Lorenza Cohen at MD Anderson Cancer Center, who's just published 2 amazing new studies as well, looking at the effects of bioenergy in a mouse model of cancer with some pretty profound results in tumor size as well as cytokine profiles. So, everything that Dan is saying is being punctuated by research, with much more, of course, to do, but very exciting and great to see our fellow scientists collaborating. So I would say, Carolina, stay tuned for even more incredible groundbreaking research with energy medicine in oncology. Mari asks, Dan, you shared that Qigong, Faye has been doing Qigong, for example, with your cancer patients for many decades. Many of us are familiar with the wonderful work that she does in Qigong energy healing. Mari wonders, what have you noticed about Qigong in particular within the oncology framework? Do you feel like, are there particular times, how, where, and when is it most supportive of the healing process?
That's a great question. I mean, it will always help. Now, we can measure it so specifically when someone is having significant physical pain or weakness or side effects from the cancer or the treatment. So we have seen patients who were in the chemo room and they were too weak to even get up. And the nurse would accompany them to the room where the Qigong was given. They would sit there having a hard time walking. And after that 45-minute or an hour session, they would always get up and dance. I mean, it's so striking, so striking. That is, I've just seen so many situations like this. We have seen, all of us, that it's miraculous. I mean, someone who can barely walk after 45 minutes of Qigong or energy work or acupuncture or all these modalities we're talking about, and the presence of a practitioner who is doing their art, but also has this true intention of be of service, we see a miraculous shift in just half an hour or 45 minutes. And
Wow. Yeah.
so that's where Qigong, people would come to Qigong if they were feeling fine as a maintenance, or if they were having a little bit of symptoms, but it was just so wonderful to see, yes, how it can happen when someone has significant physical challenges and even pain, physical pain. They didn't want to come in because they were in pain, but they knew that they would sit there and do their sitting Qigong and they would feel great afterwards. Yeah, 100%. It's not even 99%.
So it sounds like, Dan, you're saying, at many points during the process, Qigong is helpful, and for many different situations, whether it's maintenance, whether it's acute pain, um, you know, uh, just suffering, any kind of suffering at any level, you found that the Qigong is very helpful at any stage.
Absolutely.
Great. Yeah, thank you for that. We have a couple of questions about mistletoe. and other types of. So one is asking specifically about mistletoe injections, others just about mistletoe in general, and other types of supplements that maybe don't have the strongest evidence base yet. Any thoughts about mistletoe?
Yeah, so mistletoe is used a lot in Europe. There's a lot of data. They use it as palliative care, but it really works. And I haven't used it, but I do work with practitioners, physicians that understand mistletoe, when to use it and how to use it. It's an adjunct. It's one of the many different ones. So there are naturopathic doctors that use it, integrative medicine doctors that I know that have been using it. A lot of this is knowledge and intuition. And I've had patients who have really, they're so intuitive that they hear about all these different treatments, and then suddenly they feel in their body. Their intuition tells them mistletoe is for me. And that needs to be honored. So
Mhm.
out of the hundreds of different things, if not thousands of different natural treatments, what I tell people is follow your intuition. I mean, you read about all these things you hear about, but if something really attracts you and you're really in tune to your body and what it needs, then work on that. And there are a lot of doctors, I don't prescribe it, I don't do it, but there are a lot of integrative practitioners who have experience with mistletoe. It's one of the many great options. Yes.
Thank you.
There are studies. Actually, I remember at one of the oncology, when I spoke to my colleagues, oncologists, I had a couple of studies on mistletoe and they were rolling their eyes. And I said, it works. I mean, really in Europe, they've been using it for so long that we know it has its place. So I wouldn't say for everyone, but it has its place.
Thank you, Dan, for that. And kind of a complimentary question from Denise is, I'm assuming that Denise is perhaps a physician, and she says, would you kindly address how you often approach the patient who comes in with a very long list of supplements they are taking while on some of the newer immunomodulating or targeted agents, when we don't have the information about potential drug-herb interactions? So how do you?
That's a great question. Oh my goodness. So yes, that's where I really, I mean, there are a list of supplements that we know are safe. And then some of them, if we're not sure, and again, I like to work with naturopathic doctors and integrative medicine practitioners who have experience in herbal medicine and also in cancer. And sometimes we'll talk about it because I really want to bring many brains together when it's a specific decision on a patient and which ones are safe or not. And when we don't know, then what I recommend is maybe hold these supplements 1 to 2 days before the chemo and 1 to 2 days after the chemo. I mean, when we don't know,
Mhm.
um, just because there could potentially be an interaction. We know some supplements are really safe to use while on chemo. Actually, they may be helpful. And others, if we don't know, that's what we do. We just say hold for 1 to 2 days before, 1 to 2 days after. And that's where intuition comes in too.
Yeah.
Because we
That,
don't have those studies. I mean, it's so hard to do studies with all these different supplements and how they can potentially interact in anyone. If they're healthy, how can they interact in someone who has cancer? And how can they interact someone that has cancer and they're on a specific chemotherapy, immunomodulator, targeted therapies? I mean, the list goes on and on. So a lot of it is, first, it's knowledge. Second is intention to be of true service. And third is intuition. So these are all these things when practitioners, all the practitioners with integrity function with these is the knowledge, the wisdom, the intention, and the intuition.
I
Let
love
me
that.
just bring this up because I think it's important. Once I knew I'm going to make it short. This young lady who had metastatic breast cancer, this is 20 years ago, metastatic breast cancer, it was incurable. She was seen by multiple oncologists, had all the treatments. She was blind because of a brain, metastatic to her brain, taken care of by her father. She was referred to me by David Simon from the Chopra Center. And she was so spiritual. And she said, Doc, I don't have the money, so I can't see a naturopathic doctor, but I'm going to connect energetically, knowing that something on earth is a natural substance that can help me. I'm going to connect with that energetically. and had that intention and the prayer. So it was a combination of things, prayer, intention, bringing in energetically and what something that could help her. She started to get better. I mean, her cancers were shrinking. We got repeat scans and she was getting better. It wasn't a medicine we were giving her. It wasn't an herb we were giving her. It was her belief. So this is something to remember. It was so striking for me. I knew it. It existed. But just to see it, how powerful belief can be, and bringing in energetically what she thought was available somewhere on earth, not knowing what it was. So that was her intention. Very powerful.
That is so beautiful. Thank you for sharing that. Such a beautiful experience and a reminder, of the power that we have, and the power, as you've said, Dan, of hope, of belief, of all these things. We're coming close to, well, we really are at our time here. And first, Dan, I want to thank you for, what has just been an amazing and really, truly an introductory hour with you. Clearly, there's so much wisdom to explore with you. And I do hope, and I know that we will have the opportunities to have some more in-depth exploration with you on this very, very important area. And I want to thank everyone who was here. There's some questions about, well, how do we take what we've learned here and share it with our friends who have cancer, whatever. I want to remind people of a couple of organizations and websites. They were in the chat window as well. We recommend that you can share with docs, you can share with patients, with friends. One of them, the San Diego Cancer Research Institute, sdcri.org, is one. The Society for Integrative Oncology, SIO.org is my guess.
Yes.
The Academy for Integrative Health and Medicine, or AIHM.org. And then, of course, for the Biofield work and the evidence base, particularly with Biofield and cancer,
G website.
recommend chi.is. I also want to thank all of the contributors who continue to support these AMAs. We have kind of gone out on a limb with offering these AMAs. We have wonderful staff, I can't even tell you, that are helping us to put this together. It's a lot of work behind the scenes. And if you have not joined us as a contributor yet, I highly recommend you do so. I mean, not only are you supporting our nonprofit at a very low level of $108 a year, which is $9 a month, you get access to all of our webinars. We hold webinars every month and Ask Me Anything sessions every month. You have unlimited access to them all, including the slides that Dan is sharing, everybody's. And you're supporting us to continue to do these, because truly we cannot do these without your support. People joke about us being the PBS of healing. In some ways, I guess we could be considered that. And, like PBS, we only function with the support of our donors and of our supporters. So we invite you to become part of our community. You simply just go to chi.is/join to connect as a contributor, and you'll get free monthly meditations and lots of really cool stuff. So, Dan, would you like to lead us into?
Yes, I actually do want to. I'm very grateful for the Chi family, for you, Shamini, the Scientific Education Advisory Council, Board of Director, partners, collaborators, as you mentioned. So grateful to our.
Actually, if I didn't mention that Dan has been with Chi since the beginning. He is a founding partner, founding advisor, board of directors member, and he really helped incubate Chi in the very beginning when we began in 2014 as a sponsored project under SDCRI for several years. So on the Chi side as well, Dan, just thank you for all the support that you've given us over the years.
You're welcome. You're welcome. I'm so grateful to our SDCRI integrated volunteers and our coordinator, Mary Hollander, for so many years. They devoted countless hours every month to the integrated program, to be of service to the patient. While patients were getting their traditional treatment, they were offering voluntarily free services. Grateful to all the nurses, allied health professionals. You mentioned the website. The last thing I did want to say, Shamini, we talked about this earlier. I'm on a sabbatical. I'm on a professional sabbatical, personal and family sabbatical. So I'm taking this time to focus on research and education on integrative oncology. I'm seeing very few consults. I'm not looking for consults. The way for me to reach out is in situations like this and in settings like this. So I hope we can plan a webinar soon and we can have so many questions that you all have that I couldn't address today, but we can do it sometime in the future. Yeah.
Yeah. Yes, we're very grateful for that. And we'll just close maybe with a prayer of gratitude. Thanksgiving is coming, and maybe we can all just take a moment. Feel free to keep your eyes focused and open on something pleasant if you like, or close them. And let's just tap in for one moment into our hearts, giving thanks to our collective wisdom of this wonderful group of souls, of healers, of deep inquirers. Maybe we continue to nurture each other, support each other with wisdom and our spiritual guidance. Giving thanks to all of our collective contributions of love, energy, and wisdom. Thank you so much for being here. And we will be seeing you all very soon.
Thank you. I'm deeply honored for all of those who are here with us. Very, very grateful, honored, and privileged that you took this time to be with us. And for those who will listen to the video later, you're all instruments of a very important power that is being of service to others and help others, and especially in need. So deeply grateful for all of you that are here and all of the ones who are part of this Chi family, SDCRI family, AIHM family. Um, Deeply grateful and honored. Thank you. Thank you, Shaman.
Thank you. Thank you, everyone. Have a wonderful weekend.
Great.